Prevention of Tooth Decay. A digital education program. Part 2. 4 ways to prevent tooth decay. Part 2. 4 ways to prevent tooth decay. First way of prevention: 3 sugar intakes or less per day. Identifying food and drinks that cause tooth decay. Anything with added sugar, for example chocolates, sweets, energy drinks, sugary fizzy drinks. Hidden sugars are foods you consume with no obvious sugar. So check the food labels. For example, baked beans and Weetabix, fruit juice and smoothies count as a sugar intake, because they are concentrated fruit sugars. Dried fruit count as a sugar intake, because they are concentrated fruit sugars. For example raisins, but not normal fruit, because they encase the fruit sugar in fiber. Honey and jams. Bread and other starchy carbohydrates can cause tooth decay, especially if they stay in the mouth for a long time, but are not as damaging as sugar. Milk can cause tooth decay if milk stays in the mouth for a long time. This gives the bacteria time to break down the milk sugars and produce an acid attack. So giving a baby a milk bottle to drink overnight can cause severe tooth decay. The mouth needs to be rinsed with water after consuming milk, to wash away the milk sugars. Use a food diary and record every food and drink you consume for 3 days. Diet analysis. Example of an adult food diary. The 8 a.m. meal of pancakes with jam and orange juice has how many sugar items? There are 2 sugar items of jam and orange juice. How many sugar intakes for the meal? This is the first sugar intake. The pancake with jam and orange juice are consumed at the same time, so it is 1 sugar intake, even though you had 2 sugar items. The 11 a.m. meal of dates and tea with sugar has how many sugar items? The 2 sugar items are the dates and sugar placed in the tea. This is the second sugar intake. The 1 p.m. meal of cheese ham toasty, banana, and tea with sugar has how many sugar items? The 1 sugar item is the sugar placed in the tea. The banana as a fruit does not count as a sugar item. This is the third sugar intake. The 6 p.m. meal of pasta, fruit salad, and orange juice has how many sugar items? The 1 sugar item is the orange juice. The fruit salad does not count as a sugar item. This is the 4th sugar intake. The 8 p.m. meal of crackers and cheese and tea with sugar has how many sugar items? The 1 sugar item is the sugar placed in the tea. The cracker does not count as a sugar item. This is the 5th sugar intake. The day's food has been shown as pictures on this table. What are the tactics to reduce sugar intakes? 1. Have no sugar. So remove sugar from the meal. Or replace sugar with a sugar-free item. 2. Bunch sugar items together. In the food diary, we remove sugar from the meal. So we remove sugar from tea for all meals, so no acid decay occurs, because we have less than 4 intakes of sugar in 1 day. Or we replace sugar with a sugar-free item. In the food diary, we replace sugar with a sugar sweetener in tea for all meals. Bacteria cannot change sugar sweetener into acid, so a sugar sweetener does not cause an acid attack. So no acid decay occurs, because we have less than 4 intakes of sugar in 1 day. Another example. This time, we have a child's food diary. The 8 a.m. meal of Cheerios cereal with milk and orange juice has how many sugar items? There are 2 sugar items of Cheerios and orange juice. This is the first sugar intake. The 11 a.m. meal of cookie and milk has how many sugar items? The 1 sugar item is the cookie biscuit. This is the second sugar intake. The 1 p.m. meal of cheese ham toasty, apple, and milk has how many sugar items? There are no sugar items for this meal, so there is no sugar intake for this meal. The 4:30 p.m. meal of crisps and orange juice has how many sugar items? The 1 sugar item is the orange juice. This is the third sugar intake. The 6 p.m. meal of a casserole, water, and ice cream has how many sugar items? The 1 sugar item is the ice cream. This is the fourth sugar intake. The 8 p.m. meal of toast with jam and orange juice has how many sugar items? The 2 sugar items are the jam and orange juice. This is the fifth sugar intake. The day's food has been shown as pictures on this table. In the food diary, we bunch sugar items together. The ice cream and cookie biscuit are eaten in one meal at 4:30 p.m., so no acid decay occurs, because we have less than 4 intakes of sugar in one day. To avoid tooth decay, you don't have to deprive yourself of sugar. With simple changes, you can have the same food, but bunched together to reduce your sugar intakes, or you can remove sugar from key items, for example have tea without sugar, to reduce your sugar intakes. These simple changes can make a huge difference to prevent tooth decay. Second way of prevention: flossing and brushing teeth. Clean teeth to remove plaque to reduce the amount of bacteria. Clean teeth to remove food and the foul smell. You remove rotten food and clean your fridge so you don't become ill. In the same way, food debris trapped in your teeth becomes rotten and causes bad breath. You clean your teeth so your mouth does not become ill. Second way of prevention: flossing and brushing teeth after a meal. 1. Floss food from in between teeth, straight after a meal. 2. Brush your teeth 30 minutes after your meal. Where possible, wait 30 minutes to avoid scrubbing acid, made from sugar, onto your teeth. The priority is to floss in between your teeth. Further detail on brushing can be found in the How to Prevent Gum Disease education program. Third way of prevention: use fluoride toothpaste. Fluoride makes the tooth enamel stronger. Don't rinse your mouth out after brushing with fluoride toothpaste. This is because you will wash away the fluoride in your mouth. This especially applies before going to bed, because fluoride rebuilds your enamel throughout the night, as you sleep. Fourth way of prevention: stimulate more saliva. Have a sugar-free gum or sweets after a meal, to stimulate more saliva to wash away the acid faster. Or eat a piece of cheese, because cheese soaks up acid made from sugar, and cheese contains calcium that rebuilds the tooth enamel. E-learning summary. E-learning 1, first way of prevention. Have 3 sugar intakes or less per day. E-learning 2, second way of prevention. Floss teeth after a meal and brush 30 minutes later where possible. E-learning 3, third way of prevention. Use fluoride toothpaste. E-learning 4, Fourth way of prevention. Have sugar-free sweets and gum, or cheese after a meal, to stimulate more saliva.